Okay, so Assalamu alaikum everyone. Thank you so much for joining us. Thank you to Dr. Rohan and Dr. Bilal as well, obviously. Welcome to one of IMIG's first sessions for the year. IMIG is an internal medicine group here at AKU, and our purpose is to connect aspiring students and graduates with established internists from all around the world. And that is actually one of our objectives with this new series that we're launching, the Globe Trotters, where we'll be bringing in physicians who are pursuing non-US pathways such as those in the UK, Australia, the Middle East, Asia, and others. And to help kickstart this series, we are so thrilled to have Dr. Bilal Ahmed and Dr. Rohan Tariq here with us today to start UK Pathways Explored. A little bit about our speakers. Dr. Bilal Ahmed is an emergency medicine ST5 registrar at Manchester University NHS Foundation Trust, as well as a retrieval doctor with Gamma Aviation. With a passion for life-saving medicine, he co-founded the First Response Initiative of Pakistan, FRIP, which I'm sure you must all recognize, while still in medical school at Dow, from which he graduated in 2012. His journey has taken him across continents, from a research fellowship in movement disorders at the University of Florida to the fast-paced world of emergency medicine in the UK. He has a keen interest in resuscitation, pre-hospital emergency medicine, and aviation medicine. Our second speaker for today, Dr. Rohan Tariq, is currently serving as a higher specialty trainee year 4 in gastroenterology within the Kent, Surrey, and Essex and London Deanery, with a special interest in ERCP and EUS. Dr. Tariq completed his internal medicine training in the East Midlands, where he served as the chair of the Internal Medicine Committee for the academic year 2022 to 2023. He has also served as the chairman, Young Doctors Committee at Pakistan Academy of Family Physicians before that. His passion for internal medicine started from his student days, where he undertook clinical electives at Punjab Institute of Cardiology, Lahore, Royal Blackburn Hospital, and George Washington University, DC. Alongside all of this, he also runs an Instagram page by the name lamptions_UK, where he regularly provides mentorship regarding pursuing the UK pathway. So those are our speakers for today. I'm sure you all are very excited to get to talk to them. Dr. Bilal and Dr. Rohan will be going over the process, the costs, and the prerequisites for practicing in the UK, alongside sharing some of their personal experiences. If you have any questions for them throughout the session, please feel free to drop them in the chat here. We will also be sharing a Google form in your WhatsApp chat, so do keep an eye out for that. And you can keep sending in your questions over there as well. We will have a dedicated 30-minute Q&A session at the end, so do send in your questions, and Dr. Rohan and Dr. Tariq will go over them at that point. With that, over to you, Dr. Rohan.
All right, thank you so much, Khadija, and thank you so much, IMIG, for this invitation. Well, I'm just gonna share my screen. Give me 1 second. Give me 1 second. Sorry, Khadija, I just need to quickly quit and reopen, so I'll be hardly 10 seconds. All right, I'll join you.
No worries, take your time.
Khadija, I'm just going to check my presentation, whether I can share, just as a test. Is that okay?
No problem, please. Okay, Dr. Rohan, your co-host again, please see if you can share as well.
No. Yes, I think I can do it now. Okay. All right, can you guys see my...
Yeah, we can see your.
All right, is my presentation up now here?
Yep.
Wonderful. All right, so thank you once again. Apologies for the delay. I know my Zoom needed an update. My name is Rohan. I'm a gastro trainee here in the UK. I've been in the UK for 6 years now. I've done my internal medicine stage 1 training here, and now I've just started my gastroenterology training. Well, it's been 6 months now. So thank you, IMIG, for the talk. Thank you, Khadija, and all the other co-hosts. I'm just going to dive into my talk, but just before I dive into my talk, a disclaimer that, well, actually, I don't have any disclaimers, but I was bribed into this talk by my sister, Sania Khalil, who's, I think, second year MBBS student. So she did bribe me into this talk. That's my only disclaimer for this talk. She did ask me not to embarrass her, but oh, well, there you go. All right, so I'm going to start with the part. So मैं जो ये talk करूँगा ना, it will be a bit semi-formal. I don't like to keep things very, very formal. I like to connect with all of you guys, so you can ask me questions at the end as well. Acha, let's see. Most of you have decided, let's say, to practice in the UK. आपने सोचा जी मैंने training करनी है UK में. I want to become a doctor in the UK. पहला step क्या है? What is the first step you need to do? Obviously, you need to get registered to work as a doctor in the UK, right? आप पाकिस्तान में एग्जाम्स क्लियर करते हैं, फाइनल ईयर प्रॉफ क्लियर करते हैं, एंड देन यू गेट अ PMDC रजिस्ट्रेशन, जिसके बाद यू गेट अ लाइसेंस टू प्रैक्टिस मेडिसिन इन पाकिस्तान. तो टू प्रैक्टिस मेडिसिन इन द UK आपको जनरल मेडिकल काउंसिल GMC की रजिस्ट्रेशन चाहिए, विच गिव्स यू द लाइसेंस टू प्रैक्टिस ओवर हियर. ऑलराइट. What is the common pathway to get a GMC, most common pathway, I should say, to get GMC registration? जिसके बारे में I think most of you already know. It is PLAB. Some people call it UKMLE, UKMLA, but I'll talk about that as well in a while. But it's PLAB. ठीक है ना? PLAB exam होता है, which you take. जिसके बाद, after passing both parts of your PLAB, you become registered as a doctor to practice in the UK. All right. Other than PLAB, and this was a question I got before the talk as well, are there any other ways to join the GMC? Yes, there are. A few of them I've mentioned: sponsorship, postgraduate qualifications, specialist registration, and GP registration. Because most of the audience today is mainly students and fresh graduates, so I'm just going to keep it very simple. But just to answer the question that I was asked earlier, can we do MRCP or MRCS or any sort of these exams to get GMC's registration? Yes, it comes in this second part, the acceptable postgraduate qualifications. All right. So आप MRCP करके, MRCS करके, MRCEM करके, you can also come to the you can get GMC registration and then come to the UK. Okay, but let's focus on PLAB. PLAB, a professional and linguistic assessment board, consists of two parts: PLAB 1 and PLAB 2. Before I'll get into PLAB, what exactly it is. Let's say you've decided to take PLAB, you need to be eligible to take PLAB as well. How do you become eligible to take PLAB? You need to have passed your MBBS. Well, you need to have done your MBBS degree. You cannot take PLAB during your medical school. It's only after you graduate you can take your PLABs. All right. Now that you've decided, okay, I need to take PLAB, what do you need to do first? You need to clear the language test, English language test, IELTS, yeah, OET. I know most of you have heard of IELTS already. OET, maybe, मेरे time पे, this is 7 years ago, we only had IELTS, and I think same for Bilal. But in the last couple of years, especially post-COVID, they've introduced OET as well. And general feedback जो मुझे अभी तक आया है अपने students का from my med school and generally जिनको मैं mentor करता रहा हूँ कि OET is actually quite simpler and straightforward क्योंकि उसका medical section होता है which is more suitable for all of us. So you need to clear the IELTS and OET and then you can apply for PLAB 1. Criteria, I'm just going to skim through this as well. IELTS के लिए you know कि जितने भी language tests हैं दोनों उनके अंदर you have 4 sections. You have a reading, you have a writing, you have a listening and speaking section. IELTS के लिए you need to score at least 7 out of 9 in all 4 of these sections. Jabki overall you need a score of 7.5. So obviously you need a higher score in at least one or two of those sessions. All right. You can get the, I mean, as it's mentioned, you get these scores in the same test. आप एक skill में अगर आपको, let's suppose writing में you got less than 7, but sub में you had 8, 8, 9, 9, then you won't clear the test and you have to take all of the test again. And online version is not accepted. Criteria, you took the medicine version. This is OET, by the way. OET के लिए, as I said, medical version, you need at least a grade B in each. And you need to get all of them in the same test. Again, more or less same hai dono ki cheezein. It's very straightforward. All right. All right, let's go to PLAB 1. Sorry, give me, what do you want? All right, upstairs. Okay. Sorry, that was my son. All right, PLAB 1. You've cleared your IELTS, you've cleared your OET. What do you want to do now? You're going to take PLAB 1. You've applied for PLAB 1. What is PLAB 1? जो लोग भी final year के exam, because you can only take PLAB after you've cleared your MBBS exams. So fourth year and final year के जो subjects हैं ना, mainly PLAB 1 is focused on all of those: medicine, surgery, gynae, peds, pathology, pharmacology. ये सारा उसके ऊपर based है. It's 180 MCQs which you need to attempt within 3 hours. This is the last update that I had. I'm not sure if it's changed or not, but as I said, it's very straightforward, this exam. I'll be very honest. You hardly need, I mean, preparation time. I've written 3 months. 3 months is a very generous time for PLAB 1. I'll be very honest, okay? Once you're doing your house job, especially once you've finished your final year, aapki knowledge is very fresh. I normally advise people ki usi time take your IELTS and book your exam, and within a year try to get done with this test. All right. Preparation time is 3 months. What are the sources that you can use? I've written, and these are just well, no, actually personal recommendations. जो recent recommendations आई हैं, क्योंकि I did PLAB 6 years ago. जो last year or 2 में लोगों ने PLAB 1 clear किया है, they recommended PLABable and GEMS and PLAB keys as well. ठीक है? I've written the costs as well. Great Britain pound, it's I think Pakistani 350, 360 जो भी current rate चल रहा है. It's very cheap. ठीक है? तो आप लोग, you can just buy it if you want to buy it now, but ideally right at the end of your final year. ठीक है? And mocks. 3 months is ample time for PLAB 1. ठीक है? Where can you take this test? You can take the test in Karachi and Islamabad, and test की अपनी fee क्या है? Again, not that bad, 273. I got this latest figure yesterday actually, क्योंकि every 2-3 months the price keeps going up by a few pounds. But yeah, you can take it in Islamabad or Karachi, and the fee is 273 pounds. So 180 questions, 3 hours to attempt. Very basic stuff. आप लोग जब QBank लोगे, you'll start attempting the question, you'll realize it is quite straightforward. It's not that difficult. PLAB 2, which is a bit tricky, if I'm being honest. PLAB 2 is it's an OSCE kind of an exam. In an ideal situation, you get 16 scenarios, each lasting 8 minutes. और आपको वहाँ पे different scenarios दिए होंगे, clinical, ethical, consultations, so many things जो कि you have to attempt. And to pass, I think वो median score होता है, you need to go above the median score and the median number of stations जो उस दिन जिन candidates ने attend किया था PLAB, उनका median एक निकलता है, उसके अंदर से you need to be above the 50% mark. ठीक है? 16 scenario मैंने IDD इसलिए बोला था क्योंकि मेरे एग्जाम में I don't know they had a problem or something. I ended up having 14 scenarios, but ideally it is 16. But don't be surprised अगर 1-2 scenario कम हो जाए. All right. PLAB 2 की तैयारी, I mean, this is again, I've taken a screenshot from literally इनकी GMC की website से कि PLAB 2 में what are you tested on? You're tested on data gathering, technical and assessment skills. जिसमें आपकी वही history taking, physical exam, literally the wards that you attend in your 3rd, 4th final year. उसमें आप लोग जो करते हैं history taking, physical examinations, and sometimes practical procedures. If not, as a house officer, you do get to do these practical procedures. Clinical management skills, are you able to collect all of that information and make a diagnosis and explain it to the patient? जिसका last bit है ना, interpersonal skills. ये जो ऊपर वाले दो है ना, इस पे we do not struggle, all right? Personally, what I've seen, where we struggle is this bit, interpersonal skills, okay? How do you approach this station? How do you establish a rapport with the patient? This is very, very important. And exam के अंदर सामने professional actors बैठे होते हैं, right? मेरा एक स्टेशन था जिसमें I had to break bad news to a family member, and वो जो actor थी, I think she was easily late 60s or 70s, and I had to break the news of her husband passing away or something like that. And मैंने जब वो news break की, she literally started crying with tears. तो ये एग्जाम के अंदर ना, and हम लोगों को we don't actually understand कि इस सिचुएशन में पेशेंट को कैसे how to kind of approach this situation. तो बेस्ट आंसर तो इसका मुझे किसी ने ये बताया था कि अगर पेशेंट रोने लग जाए तो यू स्टार्ट क्राइंग विद देम, ठीक है? बट दैट्स जस्ट टू टेल यू कि कितना हाउ इम्पोर्टेंट इट इज टू बिल्ड अ रैपो. तो मैं बस रोने वाला ही था बट रोया नहीं. मैंने उसको आई लिटरली आई गॉट अ ग्लास ऑफ वाटर, गेव इट टू हर, गेव हर अ टिश्यू पेपर एंड आई वाज लाइक डोंट वरी, आई अंडरस्टैंड, ब्ला ब्ला ब्ला. ये चीज सुनने में इट साउंड्स वेरी फनी एंड साउंड्स सिंपल एट टाइम्स, but trust me, जब आप उधर बैठे होंगे in front of British people, जिनको आप being in Pakistan, you can't actually relate to all the Caucasians and Africans over here, ठीक है ना? Different nationalities के, different race के लोग होते हैं. अपनों के साथ तो it's very easy to kind of emotionally connect at a point या रेपो बनाना, but उन लोगों के साथ, especially when they're talking the British accent, लोग इसको भी बहुत हल्का लेते हैं. British accent is not an easy thing to understand. तो ये सारी चीजें, this is one thing I think you need to focus on when you go for your PLAB 2. When you appearing for PLAB 2, you need to master your interpersonal skills. All right, it's about £1,000. It is what, 3.5 lakhs plus minus a few thousand rupees. It only happens in Manchester. And इसकी dates एक time पे तो बहुत मुश्किल होती थी मिलना due to COVID, and obviously इतना competition अब हो गया, but I've heard recently it's fairly easy now to get a date. All right. Preparation time 2 to 3 months. I think I would slightly increase it to 4 months. Just because आप इतना पैसा लगा के आ रहे हैं, you're spending on your ticket, you're spending on staying here, you're spending on your academy. ये मैंने academies जो by the way नीचे लिखी हैं, as I said disclaimer में start में था, I don't affiliate with any of these academies. जो this is feedback from different students जिन्होंने recently PLAB 2 दिए. ये सारी academies हैं, and this is how much they charge for 5 or 6 weeks. Roughly 650 pounds सबका जो है ना. People ask me which academy. Listen, there's no perfect or right answer for this, ठीक है? All the academies at the end of the day उन्होंने एक ही चीज़ सिखानी होती है, ठीक है? आप एक स्टेशन को कितने के तरीकों से अप्रोच कर सकते हैं. If there's a breaking bad news station, how do you think इन 4 academies ने क्या क्या different सिखाया होगा, ठीक है? And I've read notes from different academies. उनका mantra is the same, right? The key to passing PLAB 2, as I said, आप जब भी कोई भी एकेडमी अटेंड करोगे ना, यू आफ्टर अटेंडिंग फॉर कपल ऑफ वीक्स यू रियलाइज कि इस एग्जाम से आपसे क्या एक्सपेक्टेड है. व्हाट डू जीएमसी एक्सपेक्ट फ्रॉम यू इन दिस एग्जाम. कितनी आपके एक्टिंग स्किल्स अच्छे हैं, ठीक है ना, और आप कितने अच्छे इमोशनली तरीके से पेशेंट के साथ कनेक्ट कर सकते हैं. ऑलराइट, सो यू हैव टू बी वेरी गुड एक्टर, ठीक है? जैसे आप लोग वाइवा में बैठ के व्हेन द एग्जामिनर आस्क यू वेरी टफ क्वेश्चन, तो मैं तो इस पोजीशन में होता था, मैं तो सोचता था सर मुझे याद है, पढ़ा था, अभी याद नहीं आ रहा, बट मुझे ना याद है, मैंने पढ़ा था लाजमी, जब क्या नेवर इवन हर्ड ऑफ दैट ब्लडी क्वेश्चन इन माय लाइफ, ठीक है? So you need to be a very good actor actually to pass PLAB 2 is I think the gist of it. Exam मुश्किल नहीं है. I'm telling you again, exam मुश्किल नहीं है. All right. अच्छा, UKMLA इसको पढ़ने की जरूरत नहीं है. I'll tell you why. क्योंकि UKMLA इन्होंने पहले कहा था कि जी हमें we'll introduce it in 2024. If you look at their website, तो उन्होंने सारा PLAB already shifted है UKMLA की तरफ, right? UKMLA का जो भी पाथ उन्होंने एक बताया, स्ट्रक्चर बताया था, आपका PLAB जो पिछले साल से हो रहा है, it is already on the UKMLA path, और वो जो भी उसका था, ठीक है? उन्होंने नाम नहीं चेंज किया, and they basically said कि oh we will change the name in the next few years. कहने का मकसद ये है, it doesn't matter आप आज if you're a first, second, third year student, क्या आप आज PLAB ले रहे हो, कल को आपके टाइम पे UKMLA नेम चेंज हो जाता है, it doesn't matter. सारा कुछ सेम है, पार्ट 1 भी उसका सेम है, पार्ट 2 भी एग्जैक्ट प्लैब 1 और प्लैब 2 की तरह ही है, डजंट मैटर, सिर्फ नाम चेंज हो रहा है, नथिंग एल्स इज चेंजिंग, ऑलराइट, सो डोंट वरी अबाउट यूकेएमएल। टोटल कॉस्ट मैंने एवरेज लिखी है, मैंने टू बी ऑनेस्ट आई मेड दिस स्लाइड अबाउट फ्यू मंथ्स अगो, तब मैंने एवरेज लिखी थी 4 to 5 thousand, लेकिन मैंने एवरेज थोड़ी सी बढ़ा दी है क्योंकि हर चीज़ जो है ना इट्स गेटिंग अ बिट एक्सपेंसिव। अगेन डोंट होल्ड मी टू दिस कॉस्ट के सर मेरे 7,500 लग गए थे, ये हो गया था, आई एम जस्ट गिविंग यू एन एवरेज, ठीक है। टिकट प्राइसेस, रहना यहाँ पे, एग्जाम फीस, क्योंकि आप यहाँ पे जब आओगे 2-3 महीने रुकोगे फॉर प्लैब 2, कुछ लोग इलेक्टिव्स के लिए रुक जाते हैं, वील एड्रेस दिस इन द Q&A सेशन। तो ये एक जनरल मैंने एक एवरेज लिखी हुई है लोगों से पूछ के अगेन। अच्छा, that was a very, let me see the time, okay, that was a very Khadija, when I have like 5-10 minutes remaining, so just let me know, ठीक है, so I can quickly wrap this up. अच्छा, this is the main part of my talk, internal medicine training, क्योंकि I've been through this pathway. Acha, once you've done your GMC and PLAB, well, sorry, when I say once you've done your PLAB, you get your GMC registration, ठीक है। अब आपके पास दो pathways हैं to work in the UK। या आप ट्रेनिंग pathway करोगे, which is this medicine, I'm talking about medicine, okay। You will either do an internal medicine training pathway या आप non training pathway करोगे, ठीक है। ट्रेनिंग एंड नॉन ट्रेनिंग पाथवे हर स्पेशलिटी में है, इमरजेंसी मेडिसिन में, सर्जरी में, इंटरनल मेडिसिन में, पीड्स में, एवरीथिंग, सिंगल थिंग, ठीक है। यू कैन डू ट्रेनिंग और नॉन ट्रेनिंग 99% ऑफ द टाइम्स, वेल एक्चुअली अभी थोड़ी परसेंटेज कम हो गई है रिसेंटली, बट सारे के सारे लोग नॉन ट्रेनिंग पाथवे पे आते हैं ताकि उधर जाके, जैसे आपके पाकिस्तान में होते हैं ना एमओस, मेडिकल ऑफिसर्स होते हैं, वो नॉट FCPS ट्रेनीज, बट वो आपके एमओस होते हैं, वो काम कर रहे होते हैं हॉस्पिटल में, राइट, वो नॉन ट्रेनिंग में होते हैं। इसी तरह यहाँ पे नॉन ट्रेनिंग डॉक्टर्स होते हैं। तो आप, द गुड थिंग एट द मोमेंट इज कि यू कैन अप्लाई फॉर ट्रेनिंग डायरेक्टली फ्रॉम पाकिस्तान, उसके बहुत प्रोज एंड कॉन्स हैं, बाद में डिस्कस कर लेंगे। बट लेट्स से आपने पाकिस्तान बैठे यू डिसाइडेड कि मुझे नॉन ट्रेनिंग जॉब नहीं मिल रही, आई एम अप्लाइंग स्ट्रेट फॉर इंटरनल मेडिसिन ट्रेनिंग, या आप यहाँ पे नॉन ट्रेनिंग जॉब कर रहे हैं एंड आफ्टर यू डिसाइड कि आई वांट टू बिकम गैस्ट्रोएंटरोलॉजिस्ट, कार्डियोलॉजिस्ट, मैंने क्या करना है। सो योर फर्स्ट प्राइमरी एंट्री पॉइंट इज इंटरनल मेडिसिन ट्रेनिंग, ठीक है। आपने आगे गैस्ट्रो करनी है, कार्डियो, रेस्ट, हीम, जेरीज, रूम, स्ट्रोक, वटेवर, डर्मेटोलॉजी, आप इंटरनल मेडिसिन ट्रेनिंग के थ्रू ही करेंगे। हाउ टू अप्लाई, ओरियल एप्लीकेशन सिस्टम है आपका, ऑनलाइन सिस्टम है, सारी एप्लीकेशंस ट्रेनिंग की उसी के थ्रू होती हैं सबमिट, सो इट्स अ वेरी जेनेरिक सिस्टम, ओरियल एप्लीकेशन, जो हर एक के लिए यूज होता है। अच्छा, हाउ डज द प्रोसेस वर्क, यू गेट लॉन्ग लिस्टेड फर्स्ट, बेसिकली व्हाट इट मीन्स कि आपने अप्लाई किया है ओरियल पे, अब वो CV I'll discuss in a second as well, and you're long listed, they want to see are you eligible to apply for an internal medicine training post, आप उनके एलिजिबिलिटी क्राइटेरिया पे उतरते हैं या नहीं। दो एलिजिबिलिटी क्राइटेरियाज हैं, ऑलराइट। एक तो है मिनिमम एक्सपीरियंस विच इज 24 months, 2 years, ठीक है। 2 साल का एक्सपीरियंस हाउस जॉब इंक्लूड कर रहा है 1 year का, so 1 year हाउस जॉब एंड पोस्ट हाउस जॉब you need another 1 year of experience before you can apply for IMP post, all right। एक ये criteria and second is your foundation competencies, I'll talk about it in a second as well। once you get long listed, आप eligible हैं, उसके बाद वो शॉर्ट लिस्टिंग करते हैं। आई नो यहाँ पे लिखा हुआ है if capacity is sufficient, you are always shortlisted depending on your marks, आपको मार्क्स मिलते हैं, वो भी मैं अभी आगे डिस्कस करूंगा। हाउ डू यू स्कोर पॉइंट्स फॉर योर एप्लीकेशन, कितने पॉइंट्स होते हैं, कैसे स्कोर करते हैं, उन पॉइंट्स की बेसिस पे यू गेट शॉर्टलिस्टेड, ठीक है। किसी के 20 पॉइंट्स हैं, 10 हैं, 15, 25, उस बेसिस पे आपको नंबर्स दिए जाते हैं टू शॉर्टलिस्ट, एंड आफ्टर दैट शॉर्टलिस्टिंग इफ यू हैव बीन शॉर्टलिस्टेड यू विल बी इनवाइटेड फॉर एन इंटरव्यू, ठीक है। उसके बाद इंटरव्यू होते हैं, इंटरव्यू पे भी आई टच वेरी ब्रीफली एट द एंड, एंड इस सारे प्रोसेस के बाद आफ्टर बीइंग एलिजिबल एंड लॉन्ग लिस्टेड, आप अपनी CV उनको दिखाते हैं, उस पे पॉइंट्स की बेसिस पे यू गेट शॉर्ट लिस्टेड फॉर एन इंटरव्यू, एंड आफ्टर द इंटरव्यू के स्कोर आपको मिलता है, डिपेंडिंग ऑन योर फाइनल स्कोर आपको एक रैंक मिल जाता है, उस रैंक पे आप यू कैन बेसिकली गेट अ नंबर वेयर एवर। अच्छा, जो मैंने कॉम्पिटेंसी की बात की थी ना, एलिजिबिलिटी क्राइटेरिया, एक तो था 2 years जिसमें 1 year हाउस जॉब है एंड 1 year पोस्ट हाउस जॉब है। एक है आपका फाउंडेशन कॉम्पिटेंसीज, वो ये है, हमारे लिए जो IMGs हैं उनके लिए है सर्टिफिकेट ऑफ रेडीनेस टू एंटर स्पेशलिटी ट्रेनिंग, क्रेस्ट फॉर्म, ठीक है। मैं इसके ऊपर ज़्यादा नहीं जाऊंगा क्योंकि ये बहुत लंबा फॉर्म है, इट्स अबाउट 4, 5, 6 pages ना, आई डोंट नो। बट मेक अ नोट ऑफ दिस, आप लोग जो अभी हाउस जॉब कर रहे हैं, जो हाउस जॉब कर चुके हैं या हु आर इन द फाइनल ईयर, कि मुझे इस क्रेस्ट फॉर्म को साइन ऑफ कराने के लिए क्या क्या चाहिए, यू कैन गेट इट साइंड ऑफ बाय कंसल्टेंट इन पाकिस्तान, ये क्राइटेरिया है। जस्ट टाइप इन गूगल क्रेस्ट फॉर्म 2025 और आपको पता, वो यूल गेट अ लिंक फॉर द फॉर्म, ठीक है। सो दिस इज योर एलिजिबिलिटी क्राइटेरिया, ये मैंने बता दिया, यू नीड 24 मंथ्स ऑफ एक्सपीरियंस। अच्छा, शॉर्ट लिस्टिंग, ये बहुत इंपॉर्टेंट है। एंड किसी समवन आस्क्ड क्वेश्चन अबाउट सीवी एज वेल, अगर आपने सीवी बनानी है ना यूके के हिसाब से फॉर इंटरनल मेडिसिन, एंड आई एम प्रीटी श्योर बिलाल विल टॉक अबाउट दिस एज वेल, इमरजेंसी मेडिसिन दूसरों में भी ये चीज़ें मोर लेस सेम है, ठीक है। आपको ये जितने भी डोमेन्स लिखे आ रहे हैं ना, 6 डोमेन्स, इनकी बेसिस पे आपको पॉइंट्स मिलते हैं, ठीक है। वो पॉइंट्स मैं आपको बताने लगा हूँ। सो पोस्ट ग्रेजुएट क्वालिफिकेशंस, आपने प्रेजेंटेशंस की हैं कि नहीं, पब्लिकेशंस हैं, टीचिंग एक्सपीरियंस, ट्रेनिंग इन टीचिंग एंड क्यूआईपीस, ठीक है। इन बेसिस पे यू गेट पॉइंट्स, सो आई जस्ट डाइव स्ट्रेट इनटू इट। अच्छा, मैं पहले सबको बता दूं, स्पेशली जो फ्रेश ग्रेजुएट्स हैं, आप लोगों ने बिल्कुल उसे कहते हैं ना, घबराना नहीं है, क्योंकि अगर आप पोस्ट ग्रेजुएट के अंदर लिटरली 4, 3 and 1 पॉइंट्स देखो, 4 पॉइंट्स इज अ पीएचडी, ठीक है। दिस एमडी बाय द वे इज नॉट द यूएसएमएलई, दिस इज बाय रिसर्च। या मास्टर्स किया हो, ठीक है ना, एमएससी, एमए, एमआरईएस, या आपके पास कोई डिप्लोमा हो, पीजी सर्ट हो, सो यू गेट 1 पॉइंट, ठीक है। पीएचडी के 4 पॉइंट्स हैं, मास्टर्स के 3 हैं, डिप्लोमा एंड पीजी सर्ट के 1 पॉइंट है, ठीक है। मैं अभी, आई थिंक वी गॉट मोर देन 100 पीपल अटेंडिंग। इफ आई आस्क यू गाइस एट दिस पॉइंट कि यार किसके पास 4 पॉइंट्स, आई डोंट थिंक एनीवन, मेरे पास नहीं है, आई डोंट नो, बिलाल माइट हैव, बिलाल हैज डन रिसर्च, बिलाल बिलाल माइट हैव इट, बट आई एम जस्ट ट्राइंग टू गिव यू एन एग्जांपल कि लोगों के पास ये पॉइंट्स नहीं होते, सो डोंट वरी अबाउट इट। बट द पर्पस ऑफ शोइंग दिस टू यू इज कि अगर आपने प्लान किया हुआ है कि मैंने एट द एंड ऑफ द डे यूके में ट्रेनिंग करनी है, ठीक है ना, एंड अभी नहीं तो 4-5 साल बाद करनी है, वट एवर, तो यू हैव इनफ टाइम। अगर आपने सोचा कि मैंने 4-5 साल डिले करना है अपना यूके का ट्रेनिंग प्रोसीजर, तो यू हैव इनफ टाइम टू डू एनी ऑफ दीज, ठीक है, टू गेन अ पॉइंट और 3 पॉइंट्स। जितना कंपटीशन आजकल है, फाइट फॉर एवरी सिंगल पॉइंट, ओके। सो दैट्स पोस्ट ग्रेजुएट। अभी आगे मैं आऊंगा विच विल बी मोर रेलेवेंट टू ऑल ऑफ यू। प्रेजेंटेशंस, अच्छा, इसमें इफ समवन, आज की प्रेजेंटेशन सुनने के बाद समवन डिसाइड्स टुडे कि मैंने नेक्स्ट ईयर ट्रेनिंग में अप्लाई करना है, हाइपोथेटिकली स्पीकिंग, ठीक है। नवंबर में एप्लीकेशंस ओपन होती हैं हर साल, बाय द वे, फॉर राउंड 1 की नवंबर में एप्लीकेशन स्टार्ट होती हैं, और फिर वहाँ से प्रोसीजर स्टार्ट होता है, और स्टार्ट अगस्त में होती है ट्रेनिंग। तो इस साल का प्रोसीजर इज ऑन, नवंबर में स्टार्ट हुआ था, अभी इंटरव्यूज हो रहे हैं लोगों के। अच्छा, एज आई वाज सेइंग कि अगर किसी ने अभी डिसाइड किया ना यार कि आई वांट टू परस्यू मेडिसिन, इंटरनल मेडिसिन ट्रेनिंग इन द यूके, नेक्स्ट ईयर मैंने अप्लाई करना है, ठीक है, यू हैव नो एक्सक्यूज कि आपको यहाँ पे 6 पॉइंट्स क्यों नहीं मिले, ठीक है। आपने एक ओरल प्रेजेंटेशन देनी है इन विच यू वर द फर्स्ट और द सेकंड ऑथर एट अ नेशनल और इंटरनेशनल मेडिकल मीटिंग, कॉन्फ्रेंस, सेम थिंग, ठीक है। दिस इंक्लूड्स पाकिस्तान एज वेल। पाकिस्तान में इतनी इंटरनेशनल मीटिंग्स, कॉन्फ्रेंसेज होती हैं, you just need to present one single topic over there, बस, that's it, right? मैंने यही किया था, I presented one topic GI bleed के ऊपर at a Pakistan conference in Pakistan, and उसका सर्टिफिकेट लिया मैंने, and I got 6 points for this. That is all you need, right? मैं लोगों को यही कहता हूँ कि इस सेक्शन में डोंट एम फॉर एनीथिंग लेस देन 6, ये 3, 2, 2, 3, 4, इफ यू हैव इट गुड, बट ट्राई टू अचीव द हाईएस्ट स्कोर। अच्छा, एक बात मैं क्लियर कर दूं कि अगर आप मल्टीपल, इफ यू हैव लेट्स से 5 ओरल प्रेजेंटेशंस, आपको पॉइंट सिर्फ 6 ही मिलेंगे, ठीक है। या लेट्स से आपके पास ओरल प्रेजेंटेशन थी एंड यू आल्सो हैड अ पोस्टर, जो ये 4 है, यू कैन ओनली क्लेम फॉर 6 पॉइंट्स, यू कैन नॉट क्लेम फॉर 6 and 4 पॉइंट्स, ठीक है। सो हाईएस्ट सिर्फ आपको मिलता है विच इज 6, एंड एक ही मिलता है पॉइंट, राइट। सो अभी से स्टार्ट वर्किंग ऑन दिस, इवन एज स्टूडेंट्स आप लोग प्रेजेंट कर सकते हो, ठीक है ना, अपने कंसल्टेंट से, अपने जितने भी हैं आपके सीनियर्स, ट्रेनीज हैं, उनसे बात करें कि जी कोई ऐसा टॉपिक है, कोई आपकी कॉन्फ्रेंस जो आप करा रहे हैं, ब्ला ब्ला ब्ला, मुझे एक चीज़ प्रेजेंट करनी है, वहाँ पे अपना पोस्टर प्रेजेंट करना है, ओरल प्रेजेंटेशन देनी है, समथिंग, ठीक है। इट्स वेरी इजी, सो गेट 6 पॉइंट्स इन दिस। पब्लिकेशन, I will admit मेरा ये थोड़ा सा weak point है, publication research, and Bilal is, I'm pretty sure, strong in this, so I'll let him talk about this. But again, if you look at all of these, इसमें I say for juniors के try to get 5 points. PubMed, आप अपने case reports केस रिव्यूज एडिटोरियल्स पब्लिश कराओ इन अ पबमेड साइटेड, ये इंपॉर्टेंट है, ठीक है ना। एंड ट्राई टू गेट 5 points. आई हैड 3 points इन दिस क्योंकि मेरे पास एक ही केस रिपोर्ट था बाय द टाइम आई वाज अप्लाइंग इन IMT. But try to, and obviously if you can do like an original research which you get published, that is absolutely fine. But then again, as I said, ये लोगों के पास, ज़्यादा लोगों के पास नहीं होगा, even ये भी ज़्यादा लोगों के पास नहीं होगा, ठीक है। But this is something you can do even as a med student, ठीक है। आप लोग केस रिपोर्ट्स लिख सकते हो, आप लोग रिव्यूज कर सकते हो, एडिटोरियल्स कर सकते हो, alright. So try and get into this ASAP. And ये बाकी पॉइंट्स में नीचे वाले इसलिए नहीं पढ़ रहा क्योंकि आई डोंट वांट यू टू गो फॉर दीज पॉइंट्स, आई वांट यू टू गो फॉर द हाईएस्ट पॉइंट्स. बट यू कैन, अच्छा ये जो भी ये सारे टेबल्स हैं ना, अगेन दीज आर स्क्रीनशॉट्स फ्रॉम द इंटरनल मेडिसिन ट्रेनिंग. या आप लोग गूगल पे लिख देना IMT एप्लीकेशन स्कोरिंग, यू विल फाइंड ऑल ऑफ दिस इन्फॉर्मेशन. ये कोई मैं ऊपर से आसमान से नहीं उतार के लेके आया हुआ, ऑलराइट. हाँ, टीचिंग एक्सपीरियंस. अगेन 5 points, ठीक है। मैं बात ही 5 points की करूंगा क्योंकि यू कैन इजीली गेट दीज 5 points. You need to work, जिस तरह मैंने I did a demoship in physiology I did it for a year to be honest. लेकिन you only need 3 months. That is all you need. That is it. And you get 5 marks, done and dusted. Right? So try and get into teaching. और ये notes पढ़ लें, इस पे आपको ना you'll get details के क्या आपको, मैंने जो अपना लेटर बनवाया था ना एक्सपीरियंस का, मैंने उसमें एग्जैक्टली यही वर्डिंग्स यूज की थी कि आई वर्क विद लोकल ट्यूटर्स टू अरेंज ब्ला ब्ला ब्ला, ठीक है ना। तो दीज वर्डिंग्स आर वेरी इंपॉर्टेंट आपको पॉइंट्स क्लेम करने के लिए। तो मैंने यही वर्डिंग्स यूज करके वो दे दिया था एंड वो मैंने उनको एविडेंस के तौर पे अपलोड कर दिया कि जी लुक, उन्होंने लिखा हुआ कि ही इज वर्क विद लोकल ट्यूटर्स टू ऑर्गेनाइज टीचिंग प्रोग्राम्स ब्ला ब्ला ब्ला, ठीक है। सो 5 points प्लीज. लेट्स सपोज आपको मेंबरशिप नहीं मिल रही, यू कांट गेट इनटू अ फॉर्मल टीचिंग, यस गो फॉर दिस वन एज वेल, ठीक है। इट इज लेस देन, इट इज ओवर 3 months. ये देखना, रेगुलर बेड साइड एंड क्लासरूम टीचिंग, आप लोग हाउस जॉब में जब होते हो अपने फाइनल ईयर स्टूडेंट्स को, 3rd 4th ईयर स्टूडेंट्स को आप लोग ये नहीं करा सकते, इजीली करा सकते हो, ठीक है ना। बेड साइड पे एक केस पकड़ो, अच्छा 5 6 10 जितने भी स्टूडेंट्स हैं बैच, उसको पकड़ो, डू अ फुल टीचिंग सेशन और फॉर्मल फीडबैक लो उनसे, ठीक है। एक फॉर्मल फीडबैक लो एंड जैसा आपको इस सेक्शन के एंड पे यू गेट अ फीडबैक फॉर्म, तो उसको जब फिल करोगे तो यूल रियलाइज कि फीडबैक फॉर्म कैसे लेना, फीडबैक कैसे लेना होता है, राइट। बिलाल काइंडली ऑर्गेनाइज दैट फीडबैक फॉर्म, तो वो जरूर गो थ्रू इट, फीडबैक भी दें बट हैव अ लुक एट इट एज वेल कि वो फीडबैक में क्या मेंशन है और आप लोगों ने फीडबैक लेना तो कैसे फीडबैक लेना। Training and teaching. So this is different from teaching experience. Training and teaching, again, ये PG cert या diploma आ जाता है. Either you can do that, ठीक है ना, पाकिस्तान में you can do that as well. It's a year long, I think. जो मैंने किया था and I think most people have done is training and teaching. वो यहाँ पे एक कोर्स होता है, teach the teachers training course, right? तो आप लोग teach the teachers training course कर सकते हैं यहाँ पे. It's a online course, 1 day, sometimes in person as well, 1 or 2 days depending on which course you attend. तो ये तो आप पाकिस्तान से भी बैठे attend कर सकते हैं. Okay, so you get 1 point there. Quality improvement project. इसके ऊपर I can talk loads and loads and loads, but for the sake of time, basically आपने कोई एक ऐसा प्रोजेक्ट करना है which, how to explain this in short period of time. You need to show improvement in certain aspects. मैंने जो अपना प्रोजेक्ट किया था, I'll just tell you that and hopefully आपको आइडिया हो जाएगा उससे. मेरा प्रोजेक्ट था अपर GI ब्लीड के ऊपर. अपर GI ब्लीड का एक we have, and Bilal I think definitely knows this, first 24-hour परफॉर्मा है BSG का, अपर GI ब्लीड का. वो एक 1 पेज परफॉर्मा है which is a tick box exercise के पेशेंट का HP चेक किया है, उसको फ्लूइड रिससिटेट किया है, टेलीप्रेसेंट दिया है, ब्ला ब्ला ब्ला. इट्स यस एंड नो और अ टिक बॉक्स थिंग. मैंने सिर्फ 50 पेशेंट्स पकड़े अपने प्रीवियस अपर GI ब्लीड के जो हॉस्पिटल में एडमिट हुए थे, एंड आई सॉ कि उनमें से सिर्फ एक बंदे का वो फॉर्म फिल हुआ हुआ था. मैंने व्हाट डिड आई डू, आई इंट्रोड्यूस दिस फॉर्म एज अ टीचिंग सेशन. मैंने जितने भी इमरजेंसी डॉक्टर्स थे एंड एक्यूट मेडिसिन के डॉक्टर्स थे, मैंने उनको एक टीचिंग सेशन दिया कि कैन यू प्लीज फिल इन दिस फॉर्म, इसके ये फायदे हैं, ब्ला ब्ला ब्ला. नेक्स्ट मैंने अगले उस टीचिंग के बाद आई टुक अनदर 50 पेशेंट्स, और उन 50 पेशेंट्स में वो नंबर 1 से बढ़ के 20 समथिंग पे चला गया था, राइट. इंप्रूवमेंट होगी. एंड देन मैंने एक साइकिल और किया, मैंने पोस्टर्स पूरे हॉस्पिटल में लगा दिए, अगेन टीचिंग सेशंस किए, सम सॉर्ट ऑफ इंटरवेंशन आई पुट इन, जिसके बाद मैंने अगेन 50 पेशेंट्स का डेटा लिया और वो 20 से भी 30 35 तक चला गया था, राइट. मैंने इंप्रूवमेंट शो कर दी. That is, so why I'm talking about ये different cycles, आपको 2 cycles, you need to be involved in both the cycles. The reason being, if you're only involved in some of the stages, या if you've done a single cycle, तो आपके points 3 हो जाते हैं. आपने 2 cycles किए हैं और आप दोनों में involved हैं, you get 4 points. ठीक है, तो मेरा पहला cycle था जो मैंने सिर्फ oral presentations दी थी, second था जो posters लगाए थे मैंने. These are your 2 different cycles. All right, so इसमें please go for 4. एंड यू कैन डू दिस इन पाकिस्तान, राइट? पाकिस्तान में आप अपने हॉस्पिटल्स में कर सकते हैं. मैंने अपने जहाँ पे इन गुर की डॉक्टर्स एंड गुर के हॉस्पिटल, डॉक्टर्स हॉस्पिटल सर्विसेज में जहाँ पे मैंने हाउस जॉब की थी, मैंने जो स्टूडेंट्स हैं उन सबको ये करवाया है. एज मैंने ऐसा ही करवाया, जस्ट गाइडेड देम, बट दे हैव एक्चुअली डन दिस एंड कुछ लोगों ने क्लेम भी किए पॉइंट्स उसके इन ट्रेनिंग. ऑलराइट, okay, so that was a very quick overview of everything. Now at least you know कि किन चीज़ों पे काम करना है आज से. This, fair enough, if you're interested in PhD, why not start straight away? Oral presentation 6 points के लिए start working for it now. Publication के लिए start working for at least 5, at least 5. Go higher if you can, but at least 5 you can do. ठीक है, अभी से अपने सीनियर्स के पीछे पड़ जाओ कि मुझे पब्लिकेशन चाहिए, मुझे पब्लिकेशन चाहिए. दे विल गेट यू पब्लिकेशन. टीचिंग एक्सपीरियंस 5 और 3 गेट इट डन. 3 तो आप लोग कर सकते हो, 3 पे तो एक्सक्यूज होनी नहीं चाहिए. मैं तो कहता हूँ 5 पे भी नहीं होनी चाहिए, बट 3 इज एक्सेप्टेबल एज वेल. ऑलराइट, एंड ओवर हेयर अगेन 1 आप लोग कर सकते हो. क्वालिटी इंप्रूवमेंट भी जो हाउस जॉब में है, एंड समटाइम्स आई इवन से स्टूडेंट्स भी कर सकते हैं. 4 होने चाहिए पॉइंट्स इसमें, नो कॉम्प्रोमाइज. सो वंस लेट्स से आपने ये सारे स्कोर कर लिए हैं, आपके 30, आई थिंक ये 30 बनता है टोटल, बट 30 में से आपके स्कोर, आपका स्कोर है 20, राइट? आपको शॉर्टलिस्ट कर लिया गया है. ये हर साल चेंज होता है बाय द वे नंबर, ये मैं वैसे आपको एग्जांपल दे रहा हूँ. उसके बाद यू गेट इनवाइटेड फॉर द इंटरव्यू. आपके 2 स्टेशन होते हैं इंटरव्यू में, ठीक है ना? ईच स्टेशन लास्ट फॉर 11 मिनट्स. आपके पहले स्टेशन में दे टॉक थ्रू योर सीवी. ये जो पीछे सारी चीज़ें आपने मेंशन की होंगी ना, कि मैंने टीचिंग की है, मैंने पीजी सर्ट किया है, मैंने पब्लिकेशन की है, क्यूएपी किया है, ये सारी चीज़ उसमें आपसे डिस्कस करेंगे कि टॉक अबाउट यू क्यूएपी, आपने क्या किया था. मुझसे क्यूएपी के बारे में पूछा था कि आप जी लीड में आपने क्या किया था, व्हाट इम्प्रूव. तो मैंने यही सारी उसको ऑब्वियसली बट इन बिट मोर डिटेल आई काइंड ऑफ एक्सप्लेन ऑल ऑफ दिस टू देम. ऑलराइट, they will ask for your suitability. It's very basic questions. And the other part is ethical governance scenario. They'll give you a scenario, they'll talk to you about it. What will you do in this case? Different scenarios they say. It can be anything. Again, I think not for your level at this point, or not for this talk, I should say. Station 2 is purely clinical. They give you scenarios, they ask you for investigations, they ask you for diagnosis, how are you going to treat this patient. Then they ask you, how will you communicate it to the patient? Sometimes they actually have someone who's acting as a patient as well, so you might have to talk to them. And then handover, how do you hand over these patients to your team, blah blah blah. Straightforward interview. Once you get shortlisted for interview, I think you've done like 70% of your job. I'm just showing you a quick overview of the competition ratios. So if you just have a look, 2015 से लेके 2024 तक, where has it gone? And मतलब vacancies आपकी हैं around 1700 2024 में, ठीक है? Applicants देखो 6000. So competition for one IMT seat, you've got like 3.6 or 3.7 or four people fighting. ठीक है? So you're fighting against 4 people for one seat. That is why मैंने इतना आप लोगों को फोकस किया है कि हायर पॉइंट्स की तरफ जाने हैं, जो मैंने आपको एप्लीकेशन में भी सारा कुछ मेंशन किया है. And just as an FYI, this year this number went up to 8 or 9,000, I think. So खुद देखते जाओ हर साल कितना यहाँ से खास तौर पे 2,000 का जंप हो रहा है. So your CV needs to be top notch. Exactly, how do you stand out your CV? जो मैंने आपको points अभी बताए हैं, you need to work on this from now. आप स्टूडेंट भी हैं, you need to start working from this now. Case reports, आप मुझसे पूछेंगे कि how can I do it as a student? You can at least learn about research as a student, नहीं? ताकि once you come out of your med school, you've got all the tools you need to actually write a case report, to do research, whatever. For someone like me who was not interested in research at all, मैं तो अपने to be honest, I actually learned about case reports and everything after coming to the UK. So don't be like me, start working from your med school how to do this. I think community medicine में they do talk about a bit of this. अच्छा, ये मैंने स्लाइड वैसे ही डाल दी है सीवी के ऊपर, क्योंकि किसी का क्वेश्चन था सीवी के ऊपर, हाउ टू मेक अ सीवी. इट्स बेसिकली यही if you look at this, ये ऊपर obviously employment history, education, आपने MBBS, AO levels, FSC, whatever आपने जो किए awards आपने जो जीते हैं, you mention all of this. But ये नीचे देखो ना सारा कुछ conferences, publications, ये वही है सारा कुछ जो आपके उसमें use हो रहा है आपकी IMT की application में. All right. So please focus on all of those points. And inshallah, you will get into internal medicine training. To wrap it all up in the last minute, John, I know I've loaded you with lots of information, but don't worry about it. I'm just going to put this there. In case you have any questions, मैंने अपना email लिख दिया, just email me. Feel free to talk to me, all right? कोई मसला नहीं है. I can answer all your questions. Recap, आपने UK में काम करना है, चाहे ट्रेनिंग करनी है, नहीं करनी, मेडिसिन में करनी है, नहीं करनी, whatever. आपको GMC रजिस्ट्रेशन चाहिए वाया प्लैब, ठीक है, जो मोस्ट कॉमन पाथवे है, बाकी पाथवेज छोड़ दो. उसके बाद you can come as a non-trainee or a trainee, all right? If you want to apply for training, either directly sitting in Pakistan or being in the UK, you need to go through the IMT application scoring. उसमें आपकी publications हैं, teaching हैं, presentations हैं, QIP है, etc. teaching है. वो points की basis पे you get into training after getting shortlisted and then giving an interview. Oh, all right, okay. I think I would like to conclude here. I don't want to take more time. Over to you, Khadija and Bilal.
Thank you so much, Dr. Rohan. That was really informative. Dr. Bilal, why don't you take it away?
Perfect. Thank you.
How do I?
Right. I'm gonna try.
How do I stop sharing? There we go.
Right, guys. Can you see my screen?
Yes, we can see it.
And is it in slide mode?
Yep.
Excellent. Okay. Hi, everyone. My name is Bilal. First of all, disclaimer, the guy in the picture is me. Okay. I know I look nothing like it, but I decided to do this very recently. Thanks to Rohan, brilliant presentation. I don't think mine would be quite that informative. Mine's mostly on my experience so far and how to get into and probably survive in emergency medicine training in the UK. So this is my email address. Feel free to contact me if you guys need anything or have any questions. More than happy to answer or guide you towards whoever might be able to answer your questions. All right. First of all, Khadija, is the sound and everything okay?
Yep, perfectly audible.
Okay. So what my presentation is going to focus on is, well, I'm just going to talk about a tiny bit about my journey so far as from med school up till here, what I've done, just so that you can probably relate to some of the things. Pros and cons of life in the UK, which I'll try and hit on from my perspective. Rohan and I had a conversation yesterday, and we were talking about pros and cons. It's slightly different. He's the overall optimist, and I'm kind of the pessimist. But anyways, then I'll talk about the emergency medicine pathway, how to get into it, and then once you get into it, what the attractiveness of emergency medicine and the adjuncts to emergency medicine that we can practice. Right. So my journey so far. So at the end of this little section, all I want you guys to think of is, if this idiot can do it, so can I. Okay. So bear with me. Okay. So not too long ago, I was a medical student as well. Okay. So we were in first year, second year. This is a Kotri Barrage. हमने college bunk मार के हम लोग गए थे Kotri Barrage. पल्ला मछली खाने. Okay. Us 5 best friends. Just like I'm sure all of you are at the same stage. Okay. And then we got down, got focused, and we started studying. The dream was America, actually. Okay. So उस time पे हमने Fripp, we co-founded Fripp. For those of you who don't know this organization, I've put a link up top. Have a look at it. Try and get involved in it. It's a good way to build up your CV as well. Okay, so they do first response, they teach first response, and then they'll teach you to teach, and you can do multiple presentations and get feedback as well. So check it out if you need to. So yeah, medical school, man, we did that. We got a bit lucky. We got involved in a bit of research as well, and managed to publish 2 or 3 papers. But again, that was more luck in our, chalo kuch karo, ghus ke kuch karo, America jana. So anyways, America पहुंच गया था मैं, ठीक है, research fellowship उठा ली थी, step 1 कर लिया था. Then papers मैंने publish किए. The dream was surgery. Surgery करनी है. Step 1 दे दिया, सही आ गया marks. And then guess what happened? I failed my step 2 CS, my clinical skills exam, which is the easiest of the steps to pass. Would you believe? Okay, everybody will tell you that. So the point I'm trying to make is, even after that, I'm here. All right, I survived. So if any of you are having a difficult time, exam pass nahi ho raha hai, ya supply aa gayi hai, ya kuch ho gaya, doesn't matter. Okay, just keep at it and you'll be fine. All right. So after this, my wife suggested, yeah, UK chalo. Okay. Plab dete hain, because her father trained here as a urologist actually, and so she was like, yeah, plab karte hain. Aur us waqt I was like, CS fail kar liya hai, obviously plab bhi fail karunga, theek hai, plab 1 to hona nahi hai mujhse. We gave our IELTS and we took our plab 1. I completely agree with Rohan about plab 1 ke liye aapko 3 mahine se zyada nahi chahiye. Okay. People were, I remember I came out of my plab 1, or man, I graduated from Dow. Okay. हमारे ज़माने में all we used to do was pass papers कर लो, exam pass हो जाएगा. ठीक है. So plab 1, I came out of plab 1 and people were saying, yeah, it was good. There were about 60 or 70 repeats. But keep in mind, this was 9 years, 8 years ago, 9 years ago. I counted 110 repeats. Okay. Plab 1 is not a difficult exam to pass if you study. And I think he's absolutely right. After final year, your knowledge, believe it or not, is at its peak of whatever knowledge it will be. Okay. You will do your FR Chem exams, you'll do your MRCPs and whatnot, but the knowledge you'll have after 5th year of med school will be the highest amount of knowledge you'll ever have. It's the best time to start taking your exams and studying for them. Okay. After that, I ended up in the UK, right? The point is, I failed, I ended up in the UK, and I managed to give a talk to you guys today. Okay. So the point is, lage raho, it'll be fine. All right. Now, after taking my plab, so a few things that I will say, just to add on, just on plab 1, knowledge, pass papers, attempt it, you'll pass it. Okay. Where we struggle is in plab 2 is, like you said, communication skills. ठीक है. Knowledge हम लोग के पास बड़ी होती है. Communication skills हम लोग underestimate इस तरह से करते हैं कि acting है, हो जाएगी, right? What we underestimate is it's acting in a different language to a Caucasian person who you're not normally communicating with in your everyday life. And believe me, हर 5 miles पर इनका accent change होता है. ठीक है. तुम्हें कोई यॉर्कशायर का मिल गया ना, मैंने F1 और F2 अपने ईस्ट यॉर्कशायर में की थी. For the first year, every single sentence my patient used to occur, I used to say, sorry, what? Do you mind repeating this? Okay. So don't underestimate this, the communication bit. उसके लिए courses, the courses he mentioned, I've heard good things about all of them. I personally took Samson Plab. That was 9 years ago. I think उसके बाद उससे 2 साल पहले I think Swami बहुत चलता था. उसके बाद I think अभी एक Aspire करके कोई I think Manchester में करीब, I'm not completely certain. A few people I know went to Aspire as well. They passed it. The idea is if you take that course, they are going to make you practice. That is it. All it is practice. इसको पास करने के 2-3 तरीके नहीं है, एक ही तरीका है. He's exactly right. They'll teach you the same thing. All right. But my suggestion is grab somebody, take the study partner to practice with, and the courses that you go to, don't be shy of being ridiculed. Okay. Get people who will criticize you to the core. Okay. That will get you through this exam. I went to Samson, and Samson is known for absolutely berating his students. Okay. I used to sit in front and I thought I was doing pretty well. Exam se 2 दिन पहले जब मेरा last mock था, Samson destroyed me. All right. He was like, you literally, these were his words, and I'll share this with you. He said, the words that come out of your mouth are absolute shit, but you speak it with so much confidence that I might be able to buy it. So please, can you concentrate on your knowledge? Okay. My wife was with me. She was taking the same course at that time, and she had tears in her eyes. She was like, "Tumhe badi dant padi hai." And I was really happy. I was buzzing. I was like, brilliant feedback. Okay, I'm gonna study that. It was exactly what I needed to pass that exam. Okay, so the point I'm trying to make is grab somebody who will criticize you and don't be afraid to be criticized. Okay, it'll only help you. So communication bit, दूसरी चीज I would mention, the audits or the QIPs, etc. What my baseline suggestion to you guys is, UK is the UK pathway. It's a tick box exercise. Okay. If you tailor your CV to the personal specifications that he's mentioned and he put on his slides and everything, and I've got a few links coming up, use the same words that they use in your letter of recommendations, etc. You'll hit the mark. Okay. मेरा ऐसा नहीं था. मेरे actually personal specifications or marks बहुत कम थे. But because I didn't use this trick, I didn't know about it. If you're teaching something, if you're teaching 10 students, go on Google Forms, create a feedback form, and just get a feedback. That's it. You'll be able to upload it onto your portfolio or just a generic portfolio. The idea is you have evidence. Okay. This was in stark contrast to the US application. In the US application, you say you've done it, you present it on your application form, but in the interview, they'll assume that you're telling the truth. Okay. Over here, you have to prove it. आपने feedback किया, आपने teaching किया, उसका feedback का है. Oh, you don't have feedback? How can I believe you? So if you get feedback, if you have evidence of your presentations, of your teaching sessions, of your informal teaching sessions, that's what counts. Okay. So get them. It's easy. It's not rocket science. It's not hard. And with regards to the CV, there were loads of questions, I think, on the pre-talk questionnaire about, CV kaise banaye. Look at the personal specification. If you want to try for EM training, look at the personal specifications of the EM training. Design your CV that way. I'm more than, I can send over my CV to Khadija as well about how I made it. You can copy the format if you want. I mean, there are loads. Google pe jaake You can Chat GPT will make you a CV if you want. But the idea is if you tailor your CV to the personal specification of the specialty that you're applying to, the more chance you have. Okay. Right. So I won't go over everything, obviously, repeat everything Rohan just said. So pros and cons of life in the UK. I'll just touch a little bit on that. Okay. The biggest thing about working in the UK is your work-life balance will be good. Okay. मैं जब अमेरिका में था as a research fellow, I was doing 72 to 80 hours a week. Okay. First 7 months was unpaid. Okay. Now, that concept doesn't exist in the UK. Okay. When my wife and I were signing our F1 contract, we were laughing when we were signing it because we are legally bound not to exceed 56 hours of work. The hospital staff will kick you out if you're in the hospital more than that. Okay. You get for men, you get 2 weeks of paternity leave. Okay. For women, you get a year of maternity leave, 6 months of which is paid. Okay. My wife's just coming off of her maternity leave. बड़े पैसे हमने enjoy किए थे, sitting at home, not a problem. Okay. So that sort of work-life balance you will not get in the US. Okay. Australia, yes, you will. But the UK, what I found was the work-life balance is great. I managed to watch my kids, one of my kids grow up. दूसरी वाली अभी थोड़ी बड़ी हो रही है. But that is the big thing. The other pros are there's money here. Okay, if you choose to make it. We were Rohan and I were having discussions about how to it, but one caveat is if you're after money, it's not as much money as America. Okay, so usse compare aap nahi kar sakte. The American system is extremely different. It's a privatized healthcare system. Yahan pe your CEO of a company and a janitor of a company will be treated in the same room by the same people in the same time frame and the same equipment, using the same amount of medications. Okay, that is a concept that my friends in America just don't wrap their head around. Okay, so that's one of the pros. Cons are यहाँ पे ट्रेनिंग थोड़ी लंबी है. ठीक है, बिकॉज हम लोग आवर्स कम करते हैं, तो जो जनरल सर्जरी की ट्रेनिंग अमेरिका में 5 years की है तो यहाँ पे 10 years है. ठीक है, इमरजेंसी मेडिसिन ट्रेनिंग वहाँ पे 4 years है तो यहाँ पे 7 years है. इंटरनल मेडिसिन ट्रेनिंग वहाँ पे 3 years है, यहाँ पे 7 years है. ओके, you are not in a race is what I would say. ओके, कंसल्टेंट बनने की कोई जल्दी नहीं है. वो मुझे यहाँ पे आके पता चला. मेरे अब्बा अभी भी मुझे कहते हैं तुम्हें कंसल्टेंट 4 साल पहले बन जाना चाहिए था. क्या फायदा. But that is one thing that you'll have to be prepared for, right? That you will be doing hours. You'll be a resident doctor for a good few years. But at the end of it, you'll CCT or you'll Caesar or non-ticketing contract. Okay. The other pros is probably to get it. In the UK, it's 5 years, 6 years, sorry, 5 years to get your ILR, and then I think 1 more year after your ILR. Correct me if I'm wrong. I'm not completely certain. Cumulative 5 years to how to get that. Once you get your passport, it's very easy to travel. Which brings me to my other pro is you can travel very easily. Weekend पे Paris चले जाओ, ठीक है, 40 pound की flight रहेगी. Weekend पे Barcelona चले जाओ. Not that hard. We recently did something extremely stupid with 2 children. We did a day trip to Barcelona from Manchester. Suba flight leke gaya or raat mein flight leke aa gaya. Don't do that, but it's something that you can do if you're looking to travel and stuff like that. So that's a pro as well. ठीक है. कौन एक ये मैं मेंशन करूंगा अभी तो थोड़ी सी यहाँ पे what they would say saturation हो रही है थोड़ी सी. I don't know how it is down south, but yeah, Manchester में अभी क्या हो रहा है कि अभी my hospital, so I'm currently rotating through Withenshaw Hospital in Manchester. They've just sent out a junior clinical fellow, a JCF post, 5 posts. In 2 days, there were 1,100 applicants for those 5 posts. They have just shortlisted. So मुझे अभी interview panel पे होना है. So they're shortlisting to about 300 people, and then they'll give out 20 interviews from that. Okay. So because the UK has completely opened up, there's no resident medical licensing test or something, RMLT कोई था इनका. There's none of that, so everybody can apply. So people from India, Pakistan, Bangladesh, etc., are just applying in droves. Okay, so like he said, get your CV sorted from right now, and you'll end up at the top of the bunch. Then, okay, so that's the only thing I'll mention. Okay, right. So how am I for time? Okay, I'll be quick. Promise. So just the emergency medicine pathway. Okay, so I'll focus more on the training aspect of it. Okay, the non-training aspect of it, junior clinical fellows and senior clinical fellows, etc., जो कि MRChem करके कर सकते हैं, PLAB करके भी जो आते हैं, that is the same for pretty much every specialty. You go to Oriel, you go and you look at jobs, and then you apply. जब आप PLAB कर लेते हैं और आपकी GMC registration हो जाती है, so that is how you apply for any specialty. So emergency medicine is not completely exclusive to that. So I'll focus slightly more on the training aspect of the pathway. Okay. The best way, I would say, not the best way, but one of the easier ways is to get into the ACCS emergency medicine training. So that's the acute care common STEM emergency medicine training. Like IMT, so IMT is the prelude to specialty training in medicine. Okay? आप 3 साल internal medicine training करते हैं, उसके बाद फिर आप specialized training करते हैं. तो आपको cardiology करनी है, और जैसे Rohan gastroenterology कर रहे हैं. So similar to that, ED में आप ACCS करते हैं ST1, 2 and 3. ठीक है. ST1 में आपके 6 महीना emergency medicine, 6 महीना acute medicine होता है. ST2 में आपका 6 months of anesthetics and 6 months of ICU training होती है, जिसमें आप airway competencies करते हैं, lines डालना सीखते हैं, blah blah blah. ST3 में you're a junior registrar. फिर आप वापस A&E world में आते हैं, and you do 6 months of adult A&E and 6 months of pediatric A&E in a pediatric trauma center. ठीक है. Between ST1 and ST3, you need to have passed 3 exams, right? The first one is FRChem primary, which is a basic science exam. I would say just a slight step above PLAB 1, okay? Easily possible exam, I would say. Knowledge base is 5th year of medical school, okay? And pass papers, and you should be able to fly through it. It should not be a problem. Normally, people attempt that during their ST2 year, or between ST2 and before you finish off ST3 to go into ST4, you have to take your MRChem primary and MRChem OSCE. Okay? You can go online, research more on those. I won't go into too much details about these exams, but those are the exams that you need to pass before you go into higher specialty training, which is from ST4. And ST4, 5, 6 is your higher specialty training, and then you become a consultant. You come out of it CCT. Okay? So that's the ACCS pathway. The other pathway that a lot of Pakistanis, Indians and IMGs, etc. take is called, it's over here, it's called the Emergency Medicine Direct Route of Entry. Okay? Or ST3 mein bhi aate hain log, ST4 mein. I'll talk about it in a little while. These are the competition ratios. Okay? of round 1 for ACCS training for 2024. Well, and if you look at it, the competition ratio is 7.57. Madness, absolute madness. Okay. So start working on your CV right now, and you should be at the top of the pile. There is no reason why you can't match into one of these. Okay. This used to be the easiest specialty to match into because they were so short staffed, nobody wanted to do it. And then now loads of people want to do it. So this is round 1 ka competition ratio for 2024. Okay. This is round 2. Okay. Sirf ACCS ST3 ka 8.68. All right. For the dream pathway and for the ST4 pathway, it's slightly better, but you need to do a lot more for your dream pathway and for your ST3 and 4. So I'll talk about it in just a bit. So these are your timelines for your applications. Okay. Your advert normally appears in October time. November mein applications close hoti hain. Once you've applied, then you get your invitation to do the MSRA, which is an exam. What I have found out over the last few months is this test catches quite a lot of people out. Okay. People are shortlisted in quite a few specialties based on this exam, even in GP training. You have to take your MSRA. This is a situational exam. Okay. हम लोग as IMGs इस exam में इस वजह से मार खाते हैं because we don't practice in the UK. Okay. So the culture here is very different. How would you treat a drunk colleague? If your colleague turns up drunk at work, your patients are at risk, what do? How do you escalate it? What mode of escalation do you have, etc. So people need to concentrate on this exam really and not to take it lightly. Okay. So once the MSRA is done, फिर आपकी interviews होते हैं. I'll give a little snippet as to what the interview entails, and then you preference your specialties and shortlist आपका हो जाता है. Then with your interview scores and your MSRA scores, and then you preference your training posts, etc. Okay. And August में फिर training start होती है. I've given this link right up top. You can overview of core training. It's a link which includes everything, so you can do your own self-reading as well. It's very self-explanatory. You can go one by one to it. The interview format, they're basically 2 interview stations lasting up to about 10 minutes. Okay. They're different criteria from personal specifications. Like Rohan said, it's slightly different. Sometimes they may ask you to just take you through their CV. And you have to talk about it, which some people find hard. But if you've got evidence, you'll need a portfolio to take with you. And then, you can talk through it, etc. Right. I've put a link to this as well. So the dream pathway. So I didn't take this pathway, so I don't have much of a personal experience from it. But this is basically, you have to sign off your competencies for ST1 and 2, and you enter into an ST3/4 mode. Okay. And then the consultants will take you under their wing. You don't rotate through different hospitals, and you go through one hospital and you Caesar or CCT, depending on which route you take. Okay. Similarly, ST3 ke liye bhi, it's the same. I've put the link down. This is the main recruiting deanery for it. You can check. This all obviously comes after you've taken your PLAB 1 and PLAB 2. Okay. So this is further down the line. But again, if somebody's interested in emergency medicine or something, then just look over these things beforehand. Okay. So that you can tailor yourself to it. And this is for ST4. Again, I've popped the link. I'm more than happy to share my slides so you can all have these links. All right. Now, lastly, so just very quickly, emergency medicine is quite tough in the sense that it's not tough to get into and stay into. but it's tough to survive into. Okay? There was a study done, I don't know how well it's been received, etc. America mein hui thi. I think 2013 mein hui thi, or 2021 mein repeat hui thi again, where they correlated speciality to life expectancy. Okay? Usme the lowest specialty was, I think it was general surgery, was life expectancy was around 72 years. The highest was family physicians, they lived up to about 79. The only outlier was A&E. It was 57. So the highest rate of suicide, burnout, drug abuse, alcohol abuse, divorces, was actually A&E. So आजकल काफी काम हो रहे हैं A&E में about well-being and how we de-stress and stuff like that. So these are just some adjuncts that you can do apart from practicing emergency medicine. As a side hustle, you can practice these form of medicine as well. As an emergency medicine doctor, you have the ability to dual CCT in ICM and ICU. Okay? So you can become consultants for both of them. I think in medicine, you have that ability as well. You can dual CCT and triple CCT as well. So I do retrieval medicine. I was lucky enough to just get in touch with somebody who does retrieval medicine, and I'm very interested in planes. So they're like, oh, why don't you come along, see how it is? So I do retrieval medicine with Gamma Aviation in a fixed-wing aircraft from the Channel Islands. A lot of fun. The pay is horrible, but you don't do it for the pay, all right? You do it for experiences, etc. So you could get into that. You get to travel privately in private jets, etc. Bada maza aata hai. You can do some diplomas as well in retrieval and transfer medicine, not too hard to do. Put some links on there. You can, the other thing that you do, a lot of people attempt to do, is pre-hospital emergency medicine. So that's ambulance services and helicopter emergency medicine services. Cutthroat, sickest of the sick people, very, very cool sort of thing. People tend to do it for 3 or 4 years, but then burn out. But it's something that attracts a lot of people. So if you do any of the acute specialties like emergency medicine, anesthetics, or internal or ICM, you're able to then do HEMS and FEM jobs. Okay. And I've put a link for, you can do a diploma in immediate medical care, and you can look into that as well. The other thing you can do is event medicine, which, you know, it's not something that you think about when you're a med student, or even in Pakistan, that you don't come across these things. Like, मेरे अब्बा surgeon है, उन्होंने मुझे कभी नहीं बताया था कि doctors इधर भी आते हैं. But if you think about it, doctors are required everywhere. So event medicine में किसी को heart attack हो जाए, उसको कौन देखेगा? Doctor देखेगा, obviously. So you can do these. You know, concerts में you can go. You can do sports events. Boxing, UFC is big in the UK. I was called to do one event, and I managed to get into it. And the event that I was doing was the Floyd Mayweather fight in London. And the person who was actually arranging it, he was like, "Oh, Bilal, why don't you come and do Floyd Mayweather's post-fight medical?" I literally held his hands and examined him. Lucky enough, because I never thought I'd be doing it. So this is something that you can really get involved into as well. The other thing you do, if you're a football fan like me, you can do event medicine in football stadiums. So Manchester United, Manchester City, and Manchester mostly, where you basically look after the crowd. I wanted to give a shout out to this blog. This is slightly outdated, just a bit outdated based on the exams, but it gives you a good overview about dealing with emergency medicine training in the UK as an IMG. It's very specific and focused. So you can look at them as well. You can, I mean, you can either screenshot it right now and look at the blog later on, or again, I'll send you the slides. That's not a problem. Again, thank you so much for having me. I don't know how much of this was useful. Obviously, not as much as Rohan's slides because it's much more relevant to you guys, I guess. But I tried to just give my overview of how you can possibly get into the UK. And again, this idiot can do it. Surely, I mean, anybody can. So just you guys can do it. And thank you very much. If there are any questions, more than happy. What I will do is I'll just put this QR code on. If everybody can just spare about 3 or 4 minutes of their life, give us a bit of a feedback about how we did or what you would like further, especially from the organizer's point of view as well. I think I speak on behalf of both of us. Thank you so much for inviting, the first thing. And secondly, it was a brilliantly organized event and the attendance is awesome. So thank you so much for everything.
Thank you, Dr. Rohan and Dr. Bilal. It was actually very, very amazing, very informative, and I'm sure everyone was engaged throughout the entire session. Before we move on to questions and answers, people wanted one specific point reiterated, which was the UK pathway timeline as a med student, specifically from Dr. Rohan. If you could just briefly revise that point, and then we'll be going over the questions that we're receiving through the form.
All right, thank you. Thank you, Bilal. That was very interesting. You've made me think about my career choice as well. Because I will look into colons. अच्छा, टाइमलाइन की बात करते हैं प्लाट की. जो मैं टाइमलाइन बताता हूँ अपने स्टूडेंट्स को इज कि इफ़ यू देखो बाय फाइनल ईयर यू नीड टू बी क्लियर कि आपने किधर जाना है. आपने यूएस जाना है, यूके जाना है, ऑस्ट्रेलिया, वेयर एवर, ठीक है ना. यू नीड टू बी क्लियर बाय फाइनल ईयर. आइडियल सिनेरियो में बता रहा हूँ, ठीक है. मैं खुद क्लियर नहीं था बट वैसे बता रहा हूँ. आइडियली बाय फाइनल ईयर यू नीड टू बी क्लियर. नाउ दैट यू डिसाइडेड फाइनल ईयर में कि मैंने यूके जाना ही जाना है, ठीक है. as soon as you clear your final year exams, अपना IELTS बुक करो, ठीक है ना. IELTS या OET, ठीक है ना, लैंग्वेज टेस्ट बुक करा के उसमें ज़्यादा टाइम नहीं लगता. इट्स वेरी स्ट्रेट फॉरवर्ड. आई एम प्रीटी श्योर यू गाइस कैन डू इट, ठीक है ना. वो क्लियर, और जैसे ही वो क्लियर करो अपना प्लैब 1 बुक करा लो बिफोर और ड्यूरिंग हाउस जॉब, ठीक है. यू कैन आइडियली लोग क्या करते हैं, हाउस जॉब की एक रोटेशन थोड़ी सी हल्की ले लेते हैं. आई डोंट वांट टू से हल्की एज बिकॉज इट माइट बी डिसरिस्पेक्टफुल टू दैट पर्टिकुलर रोटेशन, बट जिसमें ज़्यादा स्ट्रेस ना हो, ठीक है ना. सर्जरी मेडिसिन जो होती हैं बड़ी स्ट्रेसफुल होते हैं, ऑन कॉल्स बड़ी होती हैं. बट साइकाइट्री, माय वाइफ इज गोना किल मी इफ शी हियर्स मी, बट साइकाइट्री, डर्मेटोलॉजी, जिनमें ऑन कॉल्स इतनी नहीं होते, पेशेंट लोड इज मैनेजेबल. उसके अंदर लोग नॉर्मली क्या करते हैं, बाय द एंड ऑफ देयर हाउस जॉब दे क्लियर देयर प्लैब 1. या अगर आपने हाउस जॉब में आपको टाइम नहीं मिलता, आप हाउस जॉब जैसी खत्म होती है अपना प्लैब 1 पहले से बुक कराए हो. IELTS बिफोर हाउस जॉब, प्लैब 1 ड्यूरिंग और आफ्टर हाउस जॉब, एंड उसके बाद जो भी आपको पहली डेट मिल जाती है फॉर प्लैब 2 टू क्लियर. सो आफ्टर योर ग्रेजुएशन आइडियली 1.5-2 years. अच्छा, इससे भी जल्दी हो सकता है, इट्स अप टू यू, बट मैं एक जनरल टाइम फ्रेम आप लोगों को बता रहा हूँ कि आइडियल सिचुएशन में क्या करना चाहिए आपको, क्या नहीं.
Thank you so much, Dr. Rohan. I'll be going through a few questions and we're trying to sort through some of the ones that are coming up again and again. So the first one we have from Khansa Habib, a graduate of LCMD, and they're asking, can we collect feedback forms from the juniors we teach in med school, or do we need to be associated with the specific university/institute?
I can answer that. No, not at all. You don't need to be associated with anything. Whatever you teach to 10, 15 students, 5 students, just collect some feedback that you did a teaching session for half an hour, for 45 minutes, for an hour, whether it was an informal teaching session or you use PowerPoint slides. It's irrelevant. As long as those students are relevant and they've got hands and they can give you feedback, it's absolutely fine. Just collect it and just get the evidence.
Wonderful. We have a second question from Arfa Adil from Dow Medical College. She's a 5th year, and she's asking, is teaching suturing skills considered as part of the teaching points?
Yeah, I would say so. Rohan?
Yeah, no, definitely. Anything. You can teach anything as long as it's got formal feedback. It counts as teaching. किसी को history taking सिखा दो, that counts as teaching. Anything. No specific tool.
Anything. Pick up some cannulas. Teach a first-year medical student the flow rates of cannulas and how they work. Pick up a Venturi mask and teach a first-year medical student how a Venturi mask works and what the Bernoulli principle is. It's teaching. You're using your time to impart your knowledge to somebody else. Get some feedback, and that's it. You'll get credit for it.
Thank you so much. Then we have Kasim from Bagai Medical University. He's a graduate, and they're asking, they have two questions. The first of which is for a candidate who completes 2 years of junior doctor training in the NHS through the PLAB pathway, but later wishes to pursue residency in the US. Are there any exemptions or leniencies in the application process? Additionally, from a career progression perspective, how viable is this transition?
Sorry, so just to understand the question, is it from the UK to the US?
Yes, I think it's from 2 years of junior doctor training in the NHS and then switching to the US pathway.
There is no exemptions. America is notorious for this, that you need to clear their exams, you need to clear their residencies, and then go to work there. What I would say is that once you have completed a training program here, there are some states, and this is hearsay, I've not necessarily gone and delved into this, is I think Tennessee
Florida.
and some areas in Florida, I think, they are allowing UK trained doctors to go and practice there directly without doing the residency there. But again, you'll have to be under and attending. You're not able to practice completely independently or something along those lines. I'm not completely certain about that, but I have heard of this. But again, if you want to do your residency and become a US, you want to do your private practice in the US, etc., you need to do your USMLE and be very, yeah, they're very adamant on their training.
That makes sense. Their second question is for you specifically, Dr. Bilal. They're asking, Dr. Bilal Ahmed, could you kindly share your experience as a flight doctor, including your key responsibilities in this role? Additionally, what further training opportunities are available in this field? And what career pathways or designations can one pursue in this specialty?
Yeah, that's my
Okay,
question as well.
so sorry?
That's my question to you as well, Bilal.
So flight medicine is basically, you can do three things, okay? One is pre-hospital emergency medicine, in which you're in a helicopter or a mountain retrieval service, in which case you basically get called, you work with an organization, it's normally private, it's not NHS funded mostly. Or it's a private charity that supplies the helicopters, etc. You get in touch with companies and you become a doctor with them. Now, to become a doctor with them, and the way that they'll accept you is if you're part of three specialties: emergency medicine, anesthetics, and ICM. Okay. The reason being, you're airway trained. Okay. So if I need to intubate someone on a flight, I can do it, right? That's the core competencies that they require. If somebody is extremely sick on vasopressors, you should be able to take care of it. My responsibilities in the company that I work with, we work with a fixed winged aircraft, which is double propeller aircraft, and they retrieve people from the Channel Islands. So, हमारा contract basically Guernsey Islands है. So we transport people from Guernsey to the designated hospital on the mainland. So normally it's Southampton. It could be anywhere in London. So we just basically land in Southampton. I take the patient from the flight and I put them in an ambulance and take them there. So it's a dedicated air ambulance. So my responsibilities are, it's a dedicated air ambulance. I've got two pilots, I've got myself, and I've got an ICU or an A&E nurse. We've got our equipment, we've got our two red bags, etc. But as a doctor, you don't necessarily get training for this. I didn't get training for this. I just, after my ST2, I just worked with an ICU consultant who just happened to be the medical director of this company. And he was like, oh, would you be interested in coming down, doing a few shifts with us? I was like, absolutely. This is like a dream job for me. So I went down and so they'll make you do 5 shifts in which they'll give you, for example, level 1 patients, basically very well patients whose hand you basically hold and just transport them. And then they can give you, depending on your comfort level, they can ask you to transport level 3 patients, intubated patients on vasopressors, very sick patients, etc. और उसकी एक induction होती है. There's actually a very good book called The ABC of Transfer Medicine, and उसमें flight medicine के बारे में they talk about pressure differences and altitude differences and how it can cause effects on physiology and stuff, which is good to read. But again, that's on you. If you are interested, read it. If not, then you might find yourself in the aircraft responsible for a patient who deteriorates because of certain physiological problems and you don't know about it. But it's all on you. There's no specific training for it. So this is what, as a retrieval doctor, you can do. The other thing you can do is commercial retrievals, which is basically you work with a private company and they pay you. Just as an example, कोई UK citizen holiday पे गया हुआ है to Brazil, ठीक है, अपनी टांग तोड़ देता है, उसकी सर्जरी होती है वहां पे, but he's insurance, travel insurance लेके गया था, the insurance covered it, and the insurance covers him to be flown back with a medical escort on the plane, right? So most times it's you fly from London Gatwick to Sao Paulo in Brazil. You spend a night there. You go in the morning. You see the patient. How is he? Is he okay to travel? Then you basically pick the patient up, sit in a commercial airliner with them, and you bring the patient back. And you get paid for every single hour that you travel. Okay? So lots of people do this for a living, all right? And it's a very cool thing to get into. If you're into travel, you travel the world. Okay? The company that I work with, they do commercial retrievals as well. I didn't do it initially because मेरा passport नहीं था, और अब जब passport है तो मेरे पास time नहीं. ठीक है? अभी they just did a retrieval from Athens to I think they were going to LA or somewhere, but you can do these cool things, okay? If you like traveling. So that's my responsibility as a doctor on retrieval aircrafts, and that's the career that you can potentially mold out of, doing acute A&E medicine, ICM, or anesthetics. The other thing you can also do, I didn't talk about much, is cruise medicine or expedition medicine. Have a look at wilderness medicine, etc. They do loads of that stuff. And cruise medicine is, you're a cruise ship doctor. 6 महीने की deployments होती हैं. You get paid about £20,000 a month or something, or £10,000 a month, tax-free because you're on a cruise ship. But whether you can be a GP, you can be a resuscitationist, you can be everything. So a couple of my friends are doing it from Abid. They're rotating through within shop. So yeah, there are loads of things that you can do once you come out of the bubble and you experience, medicine UK mein, it's about opportunities. It'll give you loads of opportunities. So whatever your interest is in, you can mold it around it. I hope that answers your question. Sorry, I went on a rant.
That was absolutely fascinating, Dr. Bilal. I'm sure everyone is really interested. We have another question from Aina Osman from Khyber Medical College, 5th year. And they're asking, considering the saturation of job opportunities in the UK, which pathway offers better prospects, the PLAB or the MRCP/MRCS?
Bilal, to answer this? Yeah. Okay, so.
Yeah, absolutely.
No.
Sorry, I didn't hear the question much.
Yeah, all right. So I'll give my opinion, and then if you had asked me this question a couple of years ago, 2-3 years ago, I would have said PLAB. maybe even now, I'm gonna say if you're a fresh graduate, get PLAB done and out of the way, और आप लोग साथ apply करते जाओ. But the latest trend that I've seen is कि लोगों को MRCP करने के बाद यहाँ पे ज़्यादा or whichever Royal College exam, they have better opportunities and better chances of getting into a non-training post in the UK. Having said that, मैं क्योंकि प्लैब एज अ सेड प्लैब 1 मुश्किल नहीं है, प्लैब 2 के लिए आपको 3 महीने निकालने पड़ेंगे इधर आने के लिए. उसके अलावा आपकी लाइफ कंटिन्यू रहती है. USMLEs, Bilal has done them. To be honest, I've done USMLEs as well, but my wife had other ideas, so even though I completed them, I didn't pursue it at all क्योंकि मेरी बेगम ने मुझे आना ही देना था यहाँ पे. So she was like, no, UK. So I was like, fine, UK, whatever you say. But एग्जाम्स को मैं कंपेयर कर रहा हूँ ना, तो आई रिमेंबर फॉर माई USMLEs, मैंने हाउस जॉब की थी पाकिस्तान में, तो आई वाज अ ईयर बिहाइंड ऑल ऑफ माय क्लास फेलोज. तो मुझे अगले 2 साल में आई हैड टू कैच अप, एंड मेरा भी तब उस टाइम पे CS होता था, तो आई हैड टू टेक ऑल 3 एग्जाम्स विद इन 2 years. और वो 2 साल मैं अपने घर की बेसमेंट में बंद रहा था. आई नो वो टाइम कैसा था कैसा नहीं था, जो भी था. बट I'm just telling you कि USMLE के लिए you need that sort of dedication and time. जबकि प्लैब के लिए मुझे ये सारा कुछ नहीं करना पड़ा था. सिर्फ जो मैं यहाँ पे 2 months आया था UK में, वो भी एकेडमी ली, प्रैक्टिस की, शाम को फारिग होकर घूम फिर लिया. तो यू कैन डू प्लैब ऑन द साइड, लेकिन अपनी बाकी चीजें आप प्लैब की वजह से पॉज ना करो, इज व्हाट आई एम ट्राइंग टू से. USMLE के लिए यू हैव टू पॉज थिंग्स, बट फॉर प्लैब यू डोंट नीड टू पॉज एनीथिंग. आप अपने MRCP की तैयारी स्टार्ट साथ कर सकते हो, ठीक है ना, अपने प्लैब जब आपने प्लैब की तैयारी करोगे उसके साथ. सो प्लैब शुड नॉट पुट एनीथिंग एल्स ऑन होल्ड, वट एवर यू वॉन्ट टू डू, राइट. प्लैब कैन गो अलोंग, साथ साथ आपके प्लैब भी हो जाएगा. तो इफ यू, आई वुड से डू प्लैब, बट अपने माइंड में रखो कि मैंने MRCP की तैयारी स्टार्ट करनी है साथ. क्योंकि प्लैब करने के बाद यू स्टार्ट अप्लाइंग फॉर जॉब्स. मिल गई, वेल एंड गुड, यहाँ पे आके MRCP बाकी कंप्लीट कर लो. ना मिली, डोंट वेस्ट योर टाइम उस टाइम पे. ये ना हो कि 2 साल जॉब्स अप्लाई करने के बाद, साल जॉब्स अप्लाई करने के बाद, आफ्टर प्लैब यू लाइक यार मैं MRCP कर लेता. ठीक है, इस वजह से मैं कह रहा हूँ, क्योंकि MRCP वालों को थोड़ा ज्यादा फेवर कर रहे हैं, ऑल ड्यू टू द कंपटीशन रेशो. मेरे पास कोई आएगा एप्लीकेशन लेके, 2 एप्लीकेंट्स हैं, एक के पास खाली प्लैब है, एक के पास ये लेट्स से प्लैब है और MRCP पार्ट 1 है. आई वुड प्रेफर द पार्ट 1. आई मीन बी एट पूरी CV को देख के, बट यू गेट द जस्ट.
That makes sense. We have another question from Umar. He's from Jinastan Medical University. He's a 5th year, and he's asking slightly unrelated question. Is it really hard for the couples who are doing the PLAB journey together? And what are the chances of them getting a job near each other?
Bilal, I think you did PLAB with your wife, you mentioned. So do you want to talk about the prep, and I'll talk about the jobs?
The prep bit, because it depends on it depends on your guys' relationship. I would imagine if you don't like prepping together, you don't like it. What I would say is it's easier to prep if you are with someone and you've got a study partner, but equally if your wife is critical and you don't like criticism, then it might not end well. The matching bit is, I think जब हमने किया था PLAB, and this was again 9 years ago, so I'm not completely up to date. Ron might be able to shed more light into this. But so I got an academic clinical fellow post as well, which I gave up because I was like, oh, I'll apply with my wife so that we end up in the same place. My wife scored high enough to be in central London. ठीक है, तो उसका स्कोर बहुत अच्छा था, 84 था या कुछ था, whatever. I dropped her down to East Yorkshire in Scarborough. वो मैं अभी तक सुनता हूँ. तो कपल्स मैच होता था उस जमाने में. अब अभी I think अभी भी होता है. You can couple, but I don't know. To be honest.
What I know, Bilal, is कि क्योंकि I'm going through this process right now. पहले जब मैंने IMT की थी, and मेरी वाइफ ने, she was on maternity leave, so वो 1 साल पीछे है मुझसे ट्रेनिंग में. She's a course psychiatry trainee. तो I got into East Midlands, और फिर उसको East Midlands ही, मतलब कि it's not कि वो लिंक थी हमारी एप्लीकेशन, उसको she had to score high enough to get into East Midlands. और अब मैं KSS in लंदन में चला गया हूँ, तो शी इज अप्लाइंग फॉर ST4. अब वो अप्लाई कर रही है, तो शी ऑब्वियसली उसके लिए जब वो रैंक करेगी डिफरेंट रीजन्स को, सो शी वुड वांट KSS इन लंदन टू बी एट द टॉप. That is if she still wants to live with me, but if she doesn't, she can stay here. But no, she does want to live with me. Yeah, so basically point is कि आपकी applications बिल्कुल separate treat की जाती हैं. As far as I'm aware, वो वाला जो couples pathway था वो खत्म हो गया. So you have to be very precise. अगर एक का score ज़्यादा आ गया, एक का कम आ गया, तो आपको you have to be very strategic about placing your region. किस region में आपको लगता है कि आप दोनों को साथ मिल जाएगी. वर्स्ट केस सिनेरियो, एक कोई जगह मिल गई, दूसरे को दूसरी जगह मिल गई, आप 6 months के बाद इंटरडिनरी ट्रांसफर अप्लाई कर सकते हैं, आप रीजन में ट्रांसफर कर सकते हैं, उसके अपने प्रीरेक्विजिट्स वो सारे होते हैं. बट या यू हैव ऑप्शंस, बट प्लीज डू स्टे टुगेदर, डोंट.
We have another question from Malaika Ijaz, and she is from Dilyakat University of Medical Health Sciences, Jamshoro, third year, and she has 2 questions as well. First of which is, I have a YouTube channel where I upload medical lectures. Does this experience contribute to earning teaching points?
My apologies, sorry, Avas Katpriti, so I did not.
Sorry, I'll repeat the question.
Sorry.
She's asking, I have a YouTube channel where I upload medical lectures. Does this experience contribute to earning teaching points?
Good question. I think our resident social media person will be able to answer that.
What I can do is कि जो मैंने presentation में teaching experience लिखा था ना, if you look at the table and I'll just read it out, कि एक तो पहला तो था 5 points के लिए, which basically said I have worked with local tutors to organize a teaching program for health professionals. ये local tutors would obviously mean किसी med school में, right? जो उससे नीचे वाला section है, it says I have provided regular teaching for healthcare professionals or students as a part of a defined program or course. It's यहाँ पे it's a bit, I think again it has to be a very defined program / course. I don't think that would count as well. जो last bit है ना, जिस पे 1 point मिलता है, I have taught medical students or healthcare professionals occasionally and I have received formal feedback. इसमें you can try and slide your YouTube thing in कि आपको कि जी मैं यहाँ पे I've been teaching online और उनसे आप official जिस तरह बिलाल told you before feedback ले लो. You can try and slip it in. You might get 1 point, but 3 or 5 points नहीं मिलेंगे आपको.
I think this ties in. Sorry.
Sorry. What I would say is I've just thought about this. If there's any way, I don't know how YouTube, YouTube vlogging works, etc. But if there's a way for you to catch data on your viewers and say, oh, I had these many viewers from Pakistan, I had these many viewers from India, I had these many viewers, and you collect feedback from all of that, you might be able to slip it in that I had, an international viewership for my teaching session and present it that way. So you can probably slip it in one way or the other, as long as you get feedback. And the other thing that I would say, and I'm really sorry, I just got the message, that we're getting a few messages from the international participants for whatever is being said in Urdu to be repeated in English. My sincere apologies. I did not realize that, so I'll try and speak in English as much as I can right now.
Apologies, well, I didn't realize that.
Yeah, if please feel free. I will put my email address up again. If you have any specific questions you want answering or something that I might have said in Urdu that you want repeating in English, I'm more than happy to respond to those emails. That is not a problem. And I think Rida has messaged Dr. Bilal, will FRIP level 2 count as teaching experience? Yes, it will. Just get the feedback, it will count as teaching experience.
I think this ties into their Malaika's second question as well, which is for teaching experience, is it necessary to specifically teach medical students, or would teaching FSC/intermediate students also be considered valuable experience that can help me earn points?
So no, it has to be medical students or healthcare professionals, which would include dentists and physiotherapists. But yeah, it has to be medical students. At least this is what it says on the teaching. I'll say this again. All of these extracurricular experiences that you have, and honestly, in this day and age, YouTube, as someone mentioned, and all of these things, even if they don't get you points in your CV, ठीक है ना? If they don't get you the exact points on the table, still mention them, because that kind of shows your commitment towards your specialty. Like a person who asked the YouTube question, or someone who's taught FSC students, OA level students, you won't get points, but you add it in your CV, so it tells them that you are very interested in this particular aspect. Like you're interested in teaching, so that's why you got your YouTube channel. I run an Instagram page, well, for my own med school, but I've got students from every other medical college as well. So I kind of do these sessions quite regularly over there as well. I actually mentioned that in my gastroenterology interview, because they asked. I mentioned it in my CV. I didn't score points, but they asked me. They were like, "Oh, what is this Instagram page you run?" So I kind of mentioned. I was like, "Oh, I do these teaching sessions," and they were like, "Oh, so you're into teaching?" So that kind of tells them that fine, this person is actually quite interested in this particular aspect. So yeah, do mention them in the CV. Do they get you points or not? You go through the table, you'll find out. It's very clear on the points table.
That makes sense. We have another question from Sunila Mohul from Dow, and she is a fourth-year student. And she's asking, just like the USMLE pathway has a specific YOG or year of graduation filter, does YOG also matter in the UK pathway?
No. Short answer.
Yeah.
That is very concise. Then we have Khushtaba from Foundation University Medical College, also a fourth-year student, asking what are the pathways available to medical graduates who have passed PLAB 1 and PLAB 2 or the UK MLA to pursue a medical career in countries like New Zealand and Australia, if either of you would have any insight on that.
I know about Australia that and Bilal, correct me if I'm wrong, but if you've done PLAB and if you've worked in the NHS for 2 years, 1 or 2 years, it's 1 year, is it? So
think,
1 year, then you can.
I think it might be 2. It
Two,
depends
is
on
it?
the specialty.
Yeah. So any sort of work you've done in the NHS for 2 years, it can be training, non-training, then you can move to Australia, I'm pretty sure. New Zealand, I'm not sure.
Including New Zealand. You might not get a training job. It is notoriously hard to get a training post in Australia and New Zealand. But you can definitely go there and work as a junior clinical fellow, as a senior clinical fellow, and be registered with their things. It helps a lot if you've got a British passport. Okay. If once you come here, you spend 5 years and you get a British passport, very easy. The other thing, whilst we're discussing moving away from the UK, is if internal medicine, I'm not completely certain how easy it is. But if you do GP training in the UK, or if you do emergency, once you finish, you can CCT or Caesar out to become a consultant. The next day, you can go to Canada and start practicing there. And then you can go to Australia and New Zealand as equally as well. But what I didn't know, what I recently found out, was you can just fly to Canada, land, and there'll be a job waiting for you, apparently.
In some specialties in medicine, you can do that as well now, and they're opening more and more. Because I've had a junior who did his internal medicine training here, and now he's moved to Canada. He was a Canadian national, but he worked something out, and he was telling me that, because I just asked him out of interest, if I want to come to Canada, not that I want to go to that frozen piece of, but he did say that if you want to come here, they are especially for GPs. Yes, it's already open, and for medicine as well, medicine consultants, it's opening, and a few states have already opened it. So yeah, good opportunities to go via the UK.
That is really insightful. We have one more question which kept coming up, which is how hard is it to get into competitive specialties like dermatology or ophthalmology, specifically in the UK?
I can talk about dermatology just because it's via medicine. I think me and Bilal both showed you the competition ratios for basic entrance, right? IMT and emergency medicine. You've seen what the competition ratio is at the basic level. So imagine when you're going to high specialty training like dermatology, gastro, blah, 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 it is definitely going to be higher than your entrance level competition ratio. So it is very tough. Ophthalmology is very, very tough, is what I know. I don't personally know anyone who's doing ophthalmology. Bilal might, but even dermatology is very competitive. I've seen people doing PhDs and stuff to get those points which I mentioned to secure an interview, and then in the interview they mention all of their PhDs and everything to. I'm not saying you need a PhD to get dermatology, but I'm just saying, I'm just kind of telling you what the competition ratio is. So yeah, it is very tough. So you need to work on your CV. Please don't think a basic MBBS with a basic lab is going to get you in.
Absolutely, I would concur with that. What I will say is, if you really, really, really want to do it, you'll find a way. Okay, but I will repeat something that one consultant told me. Okay, he said to me, never choose a specialty or a career looking at what the trainees are doing. Okay, you'll be a trainee for 7 or 8 years. Look at what the consultants are doing and whether there's a job market for it, what the niche is, etc. Looking at very, very niche specialties, dermatology, rheumatology, etc. Always remember, once, even if you do get into training, which is tough to begin with, there's no reason why you can't. It's not impossible, but it's tough. You'll have to work hard. If you want it enough, you'll get it. But then there will be, at specialty training and at the consultant level, there will be bottlenecks. There will be consultants who will not retire nor die to give you opportunities, etc. But so always think about that as well. Okay, because UK is a very small island, 60 million people. There will be a finite number of neurosurgeons and cardiothoracic surgeons. So think about these things.
On that exact point, because someone asked about, yeah, exactly. Someone's just asked about surgery as well. As Bilal said, it's not impossible, right? Nothing is impossible here in the UK. Because if you think about it, even the UK grads are being tested on the same, unki application bhi, it's the same exact formula. It's the same point system and then interviews. So they are claiming points for the same things you are. And after claiming those points, they are getting into interviews, and it's all about your interview skills. How easily can you impress the interviewers? It all depends on you. So it's a very fair process to get into any type of surgery, be it plastic. Someone's asking about plastic surgery again. As I said, if you can impress the interviewers, if you have a smashing CV, no one can stop you from getting into that training. All right. So don't be discouraged by someone who says it's impossible. Nothing is impossible. Why is it impossible? Everyone is, even the UK grads and the IMGs, they're on the same platform. They've got the same level playing field. So why are they getting into those higher, specialties, plastic surgeries or whatever, cardiac thoracics, and you are not getting into it? So it's the same playing, it's a level playing field. So you can easily get into it. Just work on your CV.
That makes a lot of sense. We have one last question from the forums. This is Muhammad Ahmed from Nishtar Medical University. He is a fourth year, and he's asking, I am preparing for my USMLE exams. My question is whether I can get EGMC registration with the USMLE Step 1 and Step 2, or would the PLAB be compulsory?
So what I remember, and Bilal, again, correct me if I am wrong, I had a friend who got his GMC registration based on his USMLE, but, and this is a huge but, the GMC at that point said you need to have cleared your CS exam as well. And now the CS exam is no more. So there's this confusion. I can always have a look into it and let whoever asked this question, they can email me, I can get back to them. But as far as I remember, you need your CS exam as well. So the old USMLE graduates, or the people who've done USMLE in my time or Bilal's time, they can still get GMCs registered based on their USMLE exams. But post, CES cancellation, I'm not sure.
Yeah, I would agree with that. I think it was the old one, but the new one I'm not completely certain about. I'm not up to date with it. I'm sorry.
That makes sense. Those are most of our repeated questions from the forums. If there were any points of information that you would like to reiterate, please feel free to do so. And with that, I would like to thank you guys once again. I think this has been one of the most informative yet engaging sessions we've had so far. And the audience has been really like inquisitive. Everyone wants to know more about what you're saying. And I would like to hand it off to Hufria for some ending comments.
Hello, everyone. I'm the director of the Alumni and Outreach Wing of the Internal Medicine Interest Group at AKU. Thank you so much, Dr. Bilal and Dr. Rohan, for joining in. I'm sure the 56-hour per week workload is still quite hectic, and it was really amazing for you to have you guys here, even after all that workload. So thank you so much. It was very insightful. I've already received quite a bit of feedback on private chat from a lot of my friends who joined in from other medical schools as well. So it's been an amazing journey so far. It was really great to have you all for the inauguratory session of the Globe Trotter series. And I would like to take the time to thank my co-directors of the wing as well, namely Khatija Shafiq, our host for today, as well as Ramsha, who was dealing with the entire session behind the scenes. And last but most importantly, I'd like to thank the audience. We had over 130 participants today, which is an amazing turnover, and everyone was super inquisitive. And I'm sure your questions were answered throughout the entire session as well. We'll have further sessions as this is going to be a longitudinal series. So make sure to fill out the feedback form and mention which other countries you would like us to feature, and we'll try and find out speakers for you guys as well. Thank you so much. And for the time being, belated Ramadan Mubarak and Allah Hafiz.